evening and welcome to the Ombudsman program. I am Chip Wilkins. Tonight I am filling in for Diane Wellborn, who is off for the month, and I will serve as your ombudsman this evening. I am actually a long-term care ombudsman, which means we work in nursing homes, assisted living, and throughout the community. And tonight we are fortunate enough to have with us Megan Euler, who is an ombudsman, but she's a MyCare ombudsman. And you hear that word MyCare and you wonder what that is. I know I did the first time I heard that. So, Megan, what is MyCare in the world of long-term care?
Hello, everyone out there. Chip, thank you. Thanks for having me. Happy to be here. Yeah, so My Care Ohio is a program for people who are called dual eligibles. That's the buzz term. Basically, what that means, folks who have Medicare and Medicaid, they're considered dual eligible. And in the state of Ohio, we implemented a program. It's actually still a demonstration, it's only in 29 counties, called My Care Ohio, with the goal of taking both sets of benefits, your Medicare benefits and your Medicaid benefits, and putting them together for one organization to manage them, with the ultimate goal of getting the individual, the consumer, better care, easier access to services and supports. Um, so, yeah, in a nutshell, that's what MyCare Ohio is. If you have Medicare, Medicaid, you live in a MyCare county, you might be on MyCare Ohio.
That's a big nutshell. I understand.
Yeah.
Uh, Let me ask you real quick because I presume we all know what Medicare and Medicaid is, and uh, to me, they used to be synonymous before my life as an ombudsman. But what Medicare and Medicaid? Let's start with Medicare. What is Medicare exactly?
Yeah, so Medicare is a federal system. So it's based upon age. If you're of retirement age and you've worked enough paying into Social Security, or Medicare is also based upon disability. So if you have a qualifying disability, such as ALS or end stage renal disease, there's a whole long list. If you go to the socialsecurity.gov website, there's a list of all the qualifying diagnoses and disabilities that could potentially help you to qualify for Medicare. And again, Medicare is a federally run program.
So Medicare's federal, and it's based on age 65 or older
Yep.
or disability. Is that right?
Yep, or a qualifying disability. Yeah, basically saying due to your disability, you can no longer work. And there's a lot of paperwork, of course, to fill out. And hopefully you qualify with your disability, and then you get the full set of Medicare benefits.
And then jumping from the federal Medicare, let's go to Medicaid. What is Medicaid?
Yeah, so Medicaid is a state system. The federal government really doesn't have anything to do with how states run their Medicaid program. Medicaid is income based. So as long as you meet income requirements, you can apply and potentially gain Medicaid. Medicaid, there are different categories. Different things go into the formula that they use to see if you qualify, based upon that income standard. So, really, applying through Job and Family Services is your best bet to see if you will be able to qualify for Medicaid. So, again, Medicaid is a state run program, Medicare is a federally run program.
Got it. And Medicaid's income based, you said, and I imagine the lower the monthly or yearly income, the more likely you are to qualify for Medicaid. Is that fair?
Yeah. Yeah, basically, yep, the lower sort of the income, the more likely you are to qualify. It also they also take into consideration, if you have a child, if you're a caregiver for an adult, who has a disability, there are different things that go into it. So really, your best bet is going to your local county job and family services, and applying for Medicaid, and then they will tell you the exact details. Are you going to
Great.
qualify? What do you need to do to qualify? Um, and then, of course, when you are dual eligible, you have both Medicare and Medicaid, that we consider full coverage. So your Medicare, is your primary. It's going to cover basically 80% of your out-of-pocket costs. And then that Medicaid kicks in as a supplement to your Medicare to help pay that 20% that the traditional Medicare program does not pay for. So it's really important. Medicaid is really important, to a lot of lower income Ohioans.
Gotcha. That helps a lot. Megan, I know that we introduced ourselves as ombudsman, but just as a bit of background, you were part of the long-term care ombudsman's office. What is that?
Yeah, so the long-term care ombudsman in every county in Ohio, we have a state ombudsman located in Columbus. And then the state ombudsman basically runs the program in Ohio. They decide how they want the long-term care ombudsman program to operate. We are divided up into 12 different regions. We are region 2 in the Dayton area, Montgomery being our biggest county, and then kind of all the counties surrounding. And basically, is what we do. We are advocates for anybody who's receiving any sort of long-term care service or support in any setting. So, really, we're known for going to nursing homes and assisted living facilities. If residents ever are having problems, concerns, questions, they can always call us. It's absolutely free of charge. We're a nonprofit organization, and we can, jump in and do what we can to help out the problem. Not as known, we also visit adult group homes, and then we handle, in-home care complaints. So people who are on the Medicaid waiver, who are receiving services in their home, maybe having a home health care aide, maybe getting transportation services, maybe getting home delivered meals. If they ever have issues, have a problem come up, need a answer question answered, and they can't find out the answer, always give us a call. We're happy to talk through any situation and give you a little bit of guidance and see what we can do to help out.
So it sounds like you do a lot of work with individuals in nursing homes and assisted living facilities, as well as the community. Um, what are the types of issues that you handle or that people call about?
Yeah, sure. So for a setting like a nursing home, or an assisted living facility, it can be a very wide range. Anything from, you know, the food is cold or not edible, to billing issues, to billing questions, um, care concerns, residents not getting a shower, or slow response times to call lights. I mean, really a wide range, of complaints we
I see.
accept and we try and help consumers with in nursing homes and assisted living facilities. Now, in my care, Ohio, that really is different because the people who are on my care generally live in the community. There are nursing home residents who have my care Ohio, but generally the my care folks are living in the community, receiving, those supports to help keep them in their own home. Um, with that, we get a lot of complaints about denial notices for maybe equipment or transportation concerns. I was waiting, my ride didn't show up. Um, case manager concerns with My Care Ohio, you should have a case manager. So really, we will talk through any situation it is. So definitely give us a call if you're having questions and concerns, and no matter what the complaint is, we'll talk through it with you.
Great. And I know that you mentioned earlier that My Care Ohio's in 29 counties. Uh, just for our viewers who are in the greater Dayton area, what are the three counties where My Care is active right now as part of the demonstration?
Yeah, so Montgomery County, Greene County, and Clark County. So
I
if you
see.
live in one of those three counties and you become dual eligible, you have Medicare and Medicaid, you could potentially be expecting a notice letting you know that you're getting enrolled into the My Care Ohio program.
So I have, uh, for instance, let's say I have a father who is about to, he's turned 65. Does he have to do anything special, assuming he lives in Montgomery County, to enroll in my care?
No, so My Care Ohio is what's called a passive enrollment. So you don't actually have to fill out an application. You don't have to tell the state of Ohio, I want to be on My Care. There are systems at work. And the system knows when a person becomes a dual eligible. The system knows, okay, this person had Medicare, but oh, guess what? Now they also have Medicaid. So eventually, once that information works it through the state of Ohio system, it's going to ring a little bell and it's going to let Job and Family Services know that this person should be enrolled into My Care Ohio. And once that happens, the individual, they're going to get a notice in the mail from Job and Family Services. And it's going to say in big bold print, you've been enrolled into My Care and it's time to select a plan.
Understood. Now, let's start with, since we were talking about my dad at 65, he is now enrolled into My Care Ohio. Uh, does he have to stay with My Care uh, and let My Care manage his? Let's start with Medicare, because you said it's Medicare and Medicaid. So does he have to say, okay, I'm in Medicare, take me on?
Right. So keep in mind, Medicare, Medicaid equals My Care Ohio. Now, for your Medicare, the federally run insurance program, that the person can keep the same. If you have a traditional red, white, and blue Medicare card and you want to keep your traditional, you can keep it. If you have a Medicare Advantage plan, maybe Anthem or Humana or United Healthcare, those are, three big ones in our area, you can keep your Medicare Advantage plan. Or, and that's called opting out, another jargon, you can opt out of your Medicare benefits being with My Care Ohio and keep your Medicare the same.
So you can literally decide to opt out of My Care coverage and stick with your traditional Medicare. And if you have an Advantage plan you like, stay with that. And
Yep.
that's called opt out.
Yes.
Excellent. Now, is that the same for Medicaid? Can someone opt out of Medicaid when they're on
Right.
My
So
Care?
Medicaid is the opposite. Once you are enrolled into My Care Ohio and you get the notice from Job and Family Services that lets you know that, it's going to prompt you to select a plan. Um, and in our area, in the three counties, Montgomery, Greene, and Clark, we have our two My Care plans, Buckeye Health Plan and Molina Health Plan. But for your Medicaid portion, for your state-run portion in MyCare Ohio, you have to have your Medicaid benefits with either Buckeye or Molina in our MyCare counties. You cannot opt out. Your Medicaid is MyCare now, and because of that, you have to choose a MyCare plan.
Understood. And if someone were on Medicaid prior to, let's say, turning 65, I would bet some folks don't necessarily want to uh, choose Buckeye or Molina as their managers, but they have to once you hit that 65. Is that right?
Well, once you get the notice, it's not necessarily I'm
Ah,
65, now I have Medicare and Medicaid. I mean, it takes some time. It can
okay.
take up to 90 days, 3 months, but of course, with any sort of system, there can be issues and hiccups. Um, so it's not going to be instant, but definitely keep an eye out in your mail because if you are dual eligible and you just got Medicare, you already had Medicaid, um, it potentially could be coming. You potentially could get enrolled into the MyCare Ohio program. And as far as selecting a plan for your Medicaid, you really kind of want to weigh the pros and cons. And that's another thing we can help with at the Ombudsman's office. We can talk through what do you want to look for. The most important thing, though, is that your doctor is in network. So that's going to be your first question. Do you take Buckeye? Do you take Molina? And
Right.
really your primary doctor, that's the most important piece of the Medicaid MyCare puzzles, making sure that they accept that MyCare product.
And I know from working with my dad that you want to check with all your docs, right? I mean, your specialists,
Hmm.
and make sure they're part of the plan or a provider in network.
Yep.
Uh,
In network. Yep. Another buzzword.
Another buzz. Well, let's talk just a moment then. You mentioned opt out earlier. What if someone opts in and chooses, let's say, Buckeye to manage both their Medicaid and their Medicare? Are there benefits at all for uh, opting in to have my care for both Medicare and Medicaid?
Yeah, sure. There are definitely benefits for opting in because, both Buckeye and Molina, they are insurance plans. They want your business. So if you choose to opt in and have both your Medicare and Medicaid, they do have what's called value added benefits. These can change year to year, so feel free, to give our office a call, the ombudsman's office a call. We can talk through, what the value added benefits are. But basically, you're going to have one insurance card, which a lot of people like. Your Medicare, your Medicaid, it's going to be on all on one card. Another value added benefit a lot of people like is an over the counter benefit. So you're going to have access to a certain amount of money per month where you can go to like a CVS or order from a catalog. Vitamins or really, cold meds, any sort of over the counter things you might like. Some programs have like a gym membership. Of course, vision and dental
Oh,
are
yeah.
included if you opt in. So yeah, so they want your business, so they try and give you some value added benefits to, help to maybe sway you a little bit to choose to opt in. So they're managing both your Medicare and Medicaid.
Certainly something you want to include in your pro and con list when you're trying to decide
Yes.
where to go. Well, I should have brought this up earlier, and I know Miss Wellborn would have done it because she's a pro and has done this a lot of times, but we are a call in show. And you are free if anyone is watching live today on the December 12th at 7:20. p.m., you are welcome to call. The number here is 937 223 5311. 223-5311. And please call with any questions you may have. And I am bringing up the subject of questions because we just had one. And Megan, this is right up your alley, and I think perfect timing. The caller asked if I'm required to go on my care, will all of my specialists be covered, or will I have to change who I see or whom I see?
Yeah, great question. That is a really, really important question. Because, of course, when you're seeing specialists, they're specializing, right, in something specific that you need help with. And, hopefully they've gotten to know you and you've gotten to know them. Um, and unfortunately, the answer is it depends. It
Of
really
course.
just depends.
Right.
Um, I think I think a lot of specialists are sort of starting to realize that they do need to accept the MyCare Ohio. But again, you're gonna want to ask that question. You're gonna want to call the office and say, "Hey, I just got a notice. I'm going to be on My Care Ohio. I have to choose Buckeye or Molina. Do you take Buckeye? Do you take Molina?" And then depending on that answer, really, I think basing your decision on which plan you're going to choose, that'll help you to base your decision. Now, some providers don't want to accept the My Care plan. Um, but the My Care plan should work with you.
Okay.
So if it's finding a new specialist, maybe working out some sort of agreement just between your specialist and your My Care Medicaid. So really, I never take no for an answer the first time. So really just, asking questions. Again, feel free to give me and our office a call at the Long-Term Care Ombudsman. And we can talk through it, help you to ask questions and see what we can figure out. But ultimately, it is up to the specialist if they are going to choose to accept the MyCare Medicaid or not.
Well, that's a great, great point, Megan, that there are so many times that I have heard both professionally and in my day to day life where folks have said that for one reason or another, their specialist or their doctor doesn't accept, let's say in this case, Molina, which is one of the MyCare providers. But that doesn't mean that it's an absolute no. It sounds like what you're saying is that sometimes the doctor or the plan, in this case, Molina, can agree to provide services for this one patient, this one individual, and it doesn't mean that they have to accept all Molina members. So there's some room, sounds like, to negotiate in some cases.
Yeah, in some cases, definitely there's room to negotiate. And and in some cases, the My Care plans, they should always be looking for new providers, for new doctors, for new specialists to add to their network. Because it's good for them. The more doctors, the more specialists they have, um, the more their members have to choose from. So I've had situations before where, an individual has called me, concerned that their specialist is not in network with the My Care plan. And that plan actually outreached, called up the specialist and explained what they do, explained, how to do the billing and all of that, and the specialist actually decided to become in network with the MyCare plan. So it's really
Wow.
important for you to have a conversation, with whoever your insurance plan is, about what you're needing. And hopefully that insurance plan will listen and try and make it happen.
That's
It doesn't
great
always
advice,
happen.
Megan.
It doesn't always happen, but it certainly can happen.
Sure. Well, you mentioned earlier that My Care Ohio is a well, demonstration project. How long has My Care been in
Oh
this
gosh.
demonstration mode in Ohio?
Oh gosh. Um, I want to say 10 years off the top of my head.
I think
It's been
that's
a
that's
while.
right on.
Yeah, it has been a while. Um, it's been extended through 2024. That's the last sort of update we've gotten. After 2024, not really sure. Maybe the program as it is will, become adopted in Ohio and it'll go to every county. Maybe they'll decide to make some tweaks and change it up. I'm not really sure, but it's been a demonstration for a long time in the 29 counties. So after 2024, we'll just kind of have to keep our eye on it and see what the state of Ohio chooses to do with the MyCare program.
Well, you would hope during that 10 to 12 years when you get to 2024 of a demonstration that whatever kinks they needed to work out that they've got them worked out by then. That's a
Yeah,
long time on a demonstration.
yeah, it sure is.
Well, you mentioned something earlier that I wanted to follow up on. You mentioned a case manager in as part of my care. Can you explain what is a case manager and how that's unique to my care?
Yeah, yeah. So a case manager, basically they are employed by the insurance company. And the function of a case manager is to check on their members, ask questions, and really try and make sure that that individual is having all of their needs met. They have a primary doctor, they are seeing their specialists, they don't have any, concerns about getting bills in the mail. Maybe they need help arranging medical transportation. Maybe they need help finding a community support, like a food bank, or access to clothing, or maybe who do I need to call because I have a heating bill that I can't afford. That care manager not only should help them manage the health insurance side, but they should really also help to make sure the individual as a whole, all of their needs, are being met.
And if I'm someone who has, let's just say, uh, I'm only a Medicaid or a Medicare recipient, do I have access to a case manager in non-my care settings?
Again, it depends. It depends. If you're on traditional Medicare, you have a red, white, and blue card, no. And it knows the answer to that question. If you have an Advantage plan, possibly, possibly is the answer to that question. So I would encourage you to call on the back of your insurance card. There should be a member services hotline number. I would encourage you to call that hotline number and ask. And especially with MyCare Ohio, there are different sort of classifications in MyCare. So just because you're on MyCare doesn't necessarily mean you've been assigned a case manager. So if you feel like you need a case manager, you would benefit from that support on the back of your MyCare card, whether it's Buckeye or Molina, whichever plan you choose, call the member services number and ask for a case manager, and one should be assigned to you.
Megan, I thinking about the what you said regarding my care that it's in 29 counties. I presume if you're in, say, Miami County, there's not my care available in that county. Is that right?
No, there's no MyCare in Miami County. So you're probably, if you have Medicaid, you're probably just on what's called just traditional Medicaid. You probably just have a plain white sort of paper card. But no, if you don't live in a MyCare County, you're not going to be on the MyCare Ohio program.
So, what in the world happens if I move from Montgomery County to Miami County? Do I have to do anything special? Because I'm going from a
Yeah.
MyCare County to a non-MyCare County.
So anytime you move, whether it's out of county, in the same county, a street over, a city over, you always want to let Job and Family Services know that you have moved. You want to update your address to make sure anything they send out is coming to where you are. So that's your first step. Anytime you move, let Job and Family Services know. Now, if you move from a MyCare County, from Montgomery, to a non-MyCare County, Miami in this case, again, the system, eventually, the system's going to kind of work itself out and realize, oh, wait a minute, this person who's a dual eligible, they have Medicare and Medicaid. They were in a MyCare Ohio County, but now they've moved to a non-MyCare County. Eventually the system is going to disenroll that person from MyCare Ohio. So if you're Medicare, if you're opted out and your Medicare is either traditional red, white, and blue, maybe an Advantage plan, nothing with that plan is going to change because that's a federal system. It's not an Ohio system.
Right.
But your Medicaid is going to change because you're going to be disenrolled from that MyCare plan. So either Buckeye or Molina. And then you're going to be just basically enrolled or changed over to just traditional, normal state of Ohio Medicaid. But with that said, there is what's called a transitional period, which is 90 days. You have 90 days where your MyCare plan is going to continue to pay your provider, your doctor, your specialist. And that MyCare Ohio plan, they should help to make your transition from the MyCare insurance to traditional Medicaid. They should help to make that pretty easy for you.
Okay.
Um, but
Good.
again, if you're having problems with that, give me a call. Give us a call at the long-term care ombudsman's office because we can
And
jump in and help.
that's great. And just so we have it out here, what is the number folks should call if they've got a question that you may be able to help?
Yeah, so 937-223-4613.
Great. Thank you.
Option two.
Option two, crazy phone systems.
Yeah.
They are wonderful though. They really are. Now, let's say I have uh, participated in MyCare. I've decided on the plan that I want to use. Am I stuck with that plan for the whole year? I chose Molina, and for some reason, I'm having issues finding providers, whatever it may be. Um, how easy or hard is it to switch from, say, Buckeye to Molina or Molina to Buckeye?
Yeah, so you're not stuck in that plan. It's not you choose your plan and that's your plan, for the rest of forever. You can switch back and forth. It is fairly easy to switch. You just need to call the Medicaid hotline number. If you just Google Ohio Medicaid hotline, the number will pop up. Or again, feel free to give me a call and I'm happy to give you the number if you need it. And you need to let Medicaid know that you want to switch your Medicaid portion of the MyCare Ohio. It typically takes a month, generally speaking, for that switch to happen. So, but again, it depends where in the month you're calling. So, say you call today, December 12th, uh, possibly by January, your Medicaid would be switched. but also maybe not. But
Okay.
again, it's important to have your address updated with Job and Family Services because they're going to send you out a notice and they're going to let you know when your new plan, what date that new Medicaid plan is going to start. But generally, it's pretty easy to flip your Medicaid, your MyCare Medicaid back and forth between the plans. I would say give it a try. Sometimes there are issues, and once you get it resolved, maybe there's a prior authorization that you need to get figured out. I would say give it a little bit of time, give it, maybe 90 days to see if the plan is going to start working for you before you decide to flip. But that's for Medicaid only. Now for Medicare, you can change your Medicare, that federal plan, but you can only change that once a year during open enrollment. And open enrollment just ended for this year. It usually starts towards the end of October, early November. So only once a year you can change your Medicare plan.
Understood. Thank you. Now, Megan, I know from doing work as a long-term care ombudsman that we've been taught and we've actually seen in the Ohio Revised Code that there are actually resident rights that are enumerated. There's 31 of them, I believe, and talks about the rights that a resident in a nursing home or assisted living facility has. Well, when you're talking about MyCare members, what should MyCare members have the right to expect about their services through MyCare Ohio?
Yeah, sure. There are definitely rights that you have as a member of MyCare Ohio. Typically, when you get enrolled into MyCare and you choose your plan, Buckeye or Molina, they're going to send you in the mail a member handbook. Uh, Take a look through that member handbook because it will have all of your rights as a member detailed and letting what you should expect. Of course, you have the right to, get any health care from a doctor, from a specialist, in your area. You shouldn't have to be traveling, hours and hours away to see a dentist. There should be one available in your area. You have the right to access mental health services. Maybe you want to see a counselor, somebody to talk to. You certainly have the right to access that. You have the right to, sort of know what your plan is providing you. And if they decide to not provide you something, deny something, you have the right to get that information, in what's called plain language, and language you can understand. A lot of times, there are even times me as the ombudsman, I see a notice and I have to really, kind of decipher what this notice is telling me. So that's really not friendly, user friendly, or helpful for the consumer, for the person who's on that plan.
Sure.
So yeah, so there are a whole list of rights. Take a look at the member handbook. And again, especially if you get a notice or they're trying to tell you something and you don't know what they're trying to say, give me a call, give us a call at the ombudsman's office. We'll sit down, we can, get a copy of the notice and read through it with you, and help you, to sort of decipher it and figure out what the plan's trying to tell you, and then come up with your response to that, whatever the notice may say.
That's great. Thank you. The If someone has a complaint involving their MyCare Ohio plan, let's say they're having trouble connecting with their case manager. How does somebody file a complaint against a MyCare plan?
Yeah, sure. So really with any insurance plan, you can file a complaint. But for my care, again, the buzzword is going to be grievance. So they should have a grievance procedure. If you call into that hotline number on the back of your insurance card, a member services representative, will answer the phone and ask how they can help you. And if you say, I want to file a grievance or I want to file a complaint, they should get you to the department who then will ask questions and take down all of the information, all of the details. The plan should be getting back with you, in a few weeks, maybe a month. But if it goes any longer, I'd say than a month, and you haven't heard back from the plan as to what the outcome is, what is the result, what happened after you filed your grievance, you definitely want to make another phone call, or of course, feel free to give me a call at our office, at the Ombudsman office, and I can help to find out what's going on. But yeah, calling member services, filing a grievance, they should take all of those details and try and help sort out whatever the issue might be.
And as the final result, if they want to file a complaint and they're not having success through other channels, they reach out to you.
Yeah, definitely. Yep.
Excellent.
Just give me a call and we can talk about whatever's going on.
Great. Megan, what are some of the types of complaints that you receive in your day-to-day work as a MyCare ombudsman from plan members?
Yeah, the number one complaint is probably going to be denial notices, especially for medical equipment. We get a lot of denial notices for things like lift chairs, scooters, power wheelchairs. There's sort of a lot of hoops maybe that the doctor has to jump through, a lot of paperwork to fill out. There have to be the correct codes and diagnoses. And so a lot of times, those medical items kind of get denied. If the T isn't crossed and the I isn't dotted, that could equal a denial. So I help, the individual work with the plan, work with the doctor's office to try and get that item approved. We, of course, get complaints about transportation. Sometimes we get complaints about home health care agencies or home health care aides, complaints about maybe not being able to reach a case manager, or maybe the case manager wasn't very helpful or rude. We get complaints about that. Unexpected bills. If you get a bill, if you're on MyCare Ohio, you really shouldn't be getting medical bills. The one exception to that sometimes are prescriptions, but really you should not be getting bills. So if you're on MyCare Ohio and you get a bill, that's a problem.
Something's wrong.
Yeah, something's wrong. You definitely want to let your case manager know if you have one, or call the plan hotline number on the back of your card. If you don't get anywhere with that, again, give me a call. So yeah, that's pretty much it. But everything in between, really, you never know. That's the exciting thing about being an ombudsman. You really never know what's
You
gonna
don't.
happen, or what complaint's gonna come in. It's always something new and different sometimes. So
Well,
it's
let's
it's
step through one real quick because I know a power wheelchair or a lift chair, um, a individual has talked with their doctor. They've been planning this, and they decide that they want to get a lift chair. How does the individual know that they have been denied? I mean, what's the process? How's that work?
so they're gonna receive a letter in the mail. Again, it's important to have your correct address with the insurance plan. So if you do move, that's another phone call you want to make to update your address with your insurance plan. But yeah, you're going to get a notice in the mail, and it's basically going to say that it's been denied.
Okay.
Denial is the key word that you're looking for because those notices can be very hard to read. But if you see the word denial, then you're gonna want to call your doctor and say, "Hey, I got this notice," because the doctor should get the denial notice as well. It should go to both the individual and the doctor or specialist, whoever it may be.
And is that a good time when they get the denial notice to reach out to the ombudsman's office, or should they wait or take some different uh, option?
Yeah, so I would say definitely the first step is going to be to call your doctor or your
Okay.
specialist. And I think once you let them know you received a denial notice, you're going to know pretty quickly from the doctor's office if they're really going to be willing to help you and sort through it, or if they're not. Some doctors, are really versed, sort of in the Medicaid world, and they're happy to help, try and figure out a denial notice. Other doctors really don't know
Right.
exactly what the notice is telling them either, and so don't really know what next steps to take. So if you feel like you're going to need a little bit of outside assistance other than, your doctor's office, definitely give us a call at the ombudsman. I've talked with plenty of doctors, plenty of specialists, help to figure out exactly what it is, what documentation is needed to get that approval for that equipment that person needs.
And it's an involved process, and I know that when they receive the denial, the individual, that there's a whole appeal process, and they probably need some help and guidance through that because there's multiple levels of appeal, aren't there?
Yeah, so a good thing to keep in mind, anytime you receive a denial notice, you have the right to appeal. And that's for any healthcare plan you're on, not just
Right.
MyCare Ohio. So definitely appeal that denial. Now you're going to have to submit more information because something somewhere along the way, some information was missing, or it wasn't presented correctly. There's something wrong if you're receiving a denial notice. So certainly figuring out what's wrong, what's missing, and then getting that missing piece to the insurance company during the appeal, that's key to switch that denial to an approval. And that again, is something I deal with all the time.
Right.
Um,
You're
so we
the
can
appeal
certainly help
pro.
to figure out, yeah, we can help to figure out where that missing piece is. Um, and hopefully your
Excellent.
doctor can get it submitted.
Well, I think we would not be doing the community a service if we didn't bring this up. That uh, I imagine that many of your MyCare members that you work with receive some type of uh, services at home, a lot of times with an aide or a nurse. At this point in time, particularly in Montgomery County, uh, what are the staffing levels like for home health care agencies?
Yeah, so really not great. Not great is the answer. We've kind of had a staffing problem for a while now. And the pandemic, definitely did not help the staffing problem. So if you're in your own home, you're in the community and you're needing extra services, um, there might be a bit of a wait. There might be a bit of a struggle trying to find a local agency who has a home health care aide available. But again, this is something a case manager can help you with.
Right,
You want to let the plan know, this is something I'm needing. And the plan really should work towards, getting you that service, that support in your home. But yeah, it is not a great time right now for home health care. There are a lot of people who need a reliable home health care aid, and it's hard to find.
And I've, over the last year, talked with several individuals who weren't receiving the home health care hours that they are supposed to be receiving. And they've either gone into assisted living or a nursing home because those services weren't available. In
Yeah.
most cases, before it gets that desperate, I think that's where folks probably need to reach out to you and to their case manager to get every resource working on that if it
Yeah.
can keep an individual home.
Definitely. I mean, I think staying in your own home is very important. And if that's what you want to do, then, certainly we should be able to make that happen.
Great. Well, as luck would have it, we have another great question coming in, two-parter, but I'll just throw you the first part to start with. Uh, and again, I know this has to be an approximation, but how many consumers are using My Care in our area? If you know.
Yeah. So in our area, gosh, I'm trying to remember that the last time I saw that information. I think statewide, I want to say the number's around 50,000. And in our area, I want to say maybe we're around 8,000 or so.
It's a
It
good
definitely, yeah,
percentage.
yeah, it depends. Um, and then, of course, you have to also keep in mind that, sometimes My Care Ohio consumers are living in nursing homes too.
Right.
Um, so that data kind of depends on where they're living, but it's a good amount of folks who are on the My Care Ohio program. And we can assume as Ohio, is aging, um, more and more people, once they reach that Medicare age, are going to be dual eligible and potentially get onto the My Care Ohio program. So it's quite a few Ohioans who are on My Care Ohio.
Well, with that many My Care members in Ohio, are you aware of any consumer advocacy groups that consumers can use other than, say, the Ombudsman's office that could help My Care members?
Yeah, sure. A big group is the Ohio Health Insurance Information Program, OSHIP, like the
There we go.
boat. They really are all things Medicare. So if you're having concerns about your Medicare plan, OSHIP is a great place to call to get some questions answered. Certainly there are other advocacy groups. There are disability advocacy groups. In our area, Montgomery County, the Access Center for Independent Living, they have a great disability advocacy group. They do a lot of really good work. Yeah, yeah, there are different ones. So again, if you're looking for an advocacy group, I'd be happy to help you try and find, what you're looking for. But yeah, there are some really good advocacy groups in Ohio.
Sounds like any kind of My Care questions, you are a good resource for uh, individuals in the community to reach out to, and we would absolutely recommend that. And Megan, as we are winding up the program, I wanted to make sure folks knew that you used to be, and many moons ago, our volunteer coordinator at the Ombudsman's office. And volunteers are a huge part of our program. It's all part of the business model. And anyone who has a heart for service, for seniors or anyone who's disabled, the Ombudsman office is a great place to serve as a volunteer. Megan, when you were volunteer coordinator, how many volunteers did approximately the office have?
Yeah, I think when I was volunteer coordinator back towards 2015, 2016, I think we had upwards of 30 volunteers. We had
And
quite a few volunteers. Yeah.
I think we topped off right before COVID hit, right over just over 40, and now we are sadly down to uh, around 10 volunteers. It fluctuates a little bit because uh, folks are concerned about going into facilities. So we would we want to get those numbers up, and anyone who is interested in volunteering, please call 937-223-4613, and your life will never be the same. That I can promise.
Yeah. Yeah,
Uh,
we are in desperate need of volunteers. There are over 200 facilities in our area, nursing homes and assisted living facilities. There are four full-time ombudsmen, and we certainly can't be everywhere all at once. So we really rely on volunteers to sort of be our eyes and ears, in the nursing home and the assisted living, and let us know, kind of what's going on and help us to resolve problems.
Great. Well, Megan, thank you so much for joining us tonight. You have been a wealth of information. We have had a wonderful time getting to know you and my care. And next month, don't miss the show. Miss Wellborn will be back with probably the best show that the Ombudsman's office has ever presented. So you don't want to miss that. So be here in January for that show. And with that, we say goodnight.
Good night. Thanks.